Ladies and gentlemen, good morning. Our topic today is, amongst other things, our topic today is unveiling diabetes, the facts and myths and emergencies. Now, when I read up a wee bit on what a diabetic emergency could be, I was informed that if the blood sugar is extremely high or low, in a manner of speaking, it could be an emergency. And it could lead to confusion, it could lead to dizziness and breathing difficulties, and even more serious consequences on consciousness, and so on and so forth. So, while I was reviewing this, I came across an interesting word, and that word is homeostasis. And it led me into a far wider subject of the body maintaining temperature, maintaining blood pressure, maintaining blood sugar. Now, an emergency in this area could be because of extremely high or extremely low blood pressure, but more interesting for me is our speaker today. Now, Dr. Zara is in emergency medicine, and that is uh, a extremely we're all extremely dependent on our emergency medical professionals. And interestingly, Dr. Zara uh, did her MBBS from Lucknow and her DNB in emergency medicine in 2020 from Indraprastha, Delhi. And I say interesting because I am a part of both those institutions. I didn't study in the Lucknow Medical College, but I did study in Lucknow way before Dr. Zara was born, I'm sure. But nevertheless, I did study in Lucknow. And I was certainly an integral part of the Apollo Hospitals group when it came to the Indraprastha institution, which I visited often enough. Now, I see from Dr. Zara's uh, her resume as it is in front of you, she deals with exciting situations, emergencies, trauma, cardiac, neurological, respiratory. And which of us has not been to the emergency department for things like this? Only a few days back, I remember taking a colleague to uh, to an emergency, well, the emergency department because of respiratory distress, and it was a frightening situation. It was a frightening situation. But the doctor was calm, professional, comfortable, and within minutes brought things together. I also recall visiting Dr. Zara. I also had a medical situation. I mean, it's an emergency of a less serious sort. I had a bit of a tummy problem, but nevertheless, I did go to Dr. Zara. Dr. Zara was kind enough to, well, to give me whatever advice, and my problem was solved. Dr. Zara is a committed learner and is serious about professional development. I noticed she's a trainer in advanced cardiac lifestyle life support systems, pediatric life support, critical, advanced trauma, and point of care utilization. Dr. Zara is compassionate and calm under pressure, and I can certify both those aspects. But I will leave Dr. Zara to talk to us about the myths, facts, and emergencies relating to diabetes. Doc Zara, nice to see you well, in the computer, but I often see you myself when I visit you for help. Nice to have you with us, Dr. Zara.
Good morning, everyone. Good morning, sir. Thank you so much for this kind invitation, and thank you for the kind words, sir. I would quickly like to share the screen and start with the presentation, if I may. Sir, is the screen visible?
Yes, absolutely, Doc.
Okay.
You can put on the slideshow.
Yes, 1 second, sir. Okay, so quickly starting with the myths and facts and the diabetic emergencies, all related to diabetes. This wonderful session, I'm sure multiple sessions have been done so far and they have been informative. I hope I'm able to contribute some. So, starting off with the first myth, can just 1 second, yeah. So, myth number one: no one in my family has diabetes, so I won't get it. No, not true. The fact being that if there is a very strong connection with family history, but even if you don't have a family history, we have other risk factors which can lead you to diabetes without a family history. These risk factors being overweight, obesity, unhealthy diet, smoking, high blood pressure, progressive age with high cholesterol levels, sometimes in PCOD diseases. All of these could contribute to diabetes, even if you don't have a sibling or a parent with diabetes. Next, the myth, I'm not able to, 1 second, just.
Doc,
Second
it's
myth,
moving. Yeah, it's
uh,
moving.
so I'm basically 1 second. Myth number
Yeah.
two: people with pre-diabetes don't need to worry. That's also not true. The fact being, prediabetes is a condition where your sugar levels are high but not significant enough to become diabetes. This is the stage which is most crucial for you. This is the stage where prevention comes in. And if you don't take the right steps and strict measures, you may end up being a diabetic. Myth number three: I eat a lot of sugar, so I am worried I'll get diabetes. Sugar definitely is a cause of diabetes, but the pathology behind it is insulin. So, insulin in our body is the hormone which breaks down the glucose that we regularly take and uses it for energy. In diabetic patients, the body does not make enough insulin, which is why it gets stored and it increases the blood glucose levels. Without diabetes, if we continue with high levels of sugar, this can contribute to overweight and hence diabetes. So you can eat sugar, but moderation is the key. Myth number four: diabetic patients need to take special expensive meals and they can eat anything. So the key is a balanced diet in small proportions and small frequent meals, followed by small short durations of exercise. Here, moderation is the key. You don't need to buy expensive diabetic labeled foods and to control your diabetes. You can enjoy the routine food without spending a lot of money. Sometimes, on occasions, you can enjoy a few sweets as well, but the moderation is the key in this scenario. Now, well balanced diet includes a lean proteins, vegetables, healthy fats, whole grains, and some amount of sugar is also recommended along with fiber. Myth number five: sugar free tablets are completely safe and have no side effects. Although most of the sugar free tablets are safe, the safest of them all so far has been stevia, which is a natural plant based sweetener. It has 0 calories and overall they do not have a risk for cancer. But some patients might suffer problems like diarrhea, digestive issues like bloating and gas, and sensitivity. So, again, in diabetes, everything is about moderation. Myth number 6, people with diabetes can't exercise. That is completely false. Exercise is one of the most important factor that helps in controlling blood sugar levels and increase the insulin sensitivity. So exercise is actually beneficial for people with diabetes. It helps control the blood sugar levels. It helps control the weight. It helps in mood elevation. It reduces the risk of heart diseases, reduces the blood pressure, and reduces stress levels. A lot of times we feel that if we exercise, our blood sugar levels will go down. That's not true. With appropriate monitoring, exercise is proven to be more beneficial than causing harm. Short, consistent workouts are effective. And again, here, consistency is the key. Only cardio, one of the myths is that only cardio helps with diabetes. No, that's not true. Cardio is a significant part of your exercise, yes, but strength training is equally important. And it helps in metabolism and uptake of glucose. Exercise, although beneficial, cannot cure diabetes. Diabetes is a progressive disease, as I'm sure all of us are aware. It can only be controlled and it can reduce the complications and help us maintain a healthy lifestyle. Myth number 7, injecting insulin means one is not good at maintaining sugar levels. Now, that is also not true. There are two types of diabetes, type 1 and type 2. In type 1, there is a definite use of insulin because our body no longer produces it. And in type 2 diabetes, it is a progressive disease, which means the body makes less insulin over a period of time. So even if though you are having good exercise and diet control and oral medications, maybe over a period of time, your body will need insulin. It does not mean you're not doing a good job. You are doing a good job. It's just how the body is meant to function. Now, myth number 8. Please, anybody can stop me if I'm going a little fast. Dr. Wilku, am I okay or should I slow down?
No, it's okay. Perfect.
Okay. Myth number 8, low sugar levels are safer than high sugar levels. Now, here is where I come in as an emergency person. Now, sugar high, sugar low, both are a dangerous aspect. Both are an emergency situation. Now, hypoglycemia, which is low sugar levels, can cause confusion, shakiness, sweating, even loss of consciousness. And hyperglycemia can cause symptoms like thirst. You need to go to urine again. Sometimes you may have blurred vision, and sometimes you may feel just absolute fatigue and uneasiness, and you won't even realize what is wrong unless you check your sugar levels. So there are several myths about hypoglycemia that I would like to highlight. Hypoglycemia only happens in type 1 diabetes. No, it can happen in type 2 diabetics also, and people taking certain oral medications. So certain oral medications like sulfonylureas that we routinely give for diabetes control, if taken in more amount, can cause a prolonged period of hypoglycemia. You can always feel your blood sugar level. Now, this is one thing I want to emphasize on. With diabetics, with a period of time, our sugar levels, even if low, we are not able to realize that because something is called hypoglycemia unawareness, where the symptoms are absent, but the sugar levels are still low. So frequent monitoring helps us resolve this. Usually happens in patients who have a long-term diabetes. Similarly, usually a complication of diabetes is heart attack or chest pain. In a normal individual who does not have diabetes, patient can present with chest pain. But in patients who have a long-term diabetes, have a complication of heart, they might not present as chest pain because the sensitivity and awareness reduces. Even a slight discomfort or even a pain in your upper part of the tummy can mean that it is related to the heart in long-term diabetics. Then hypoglycemia is not serious. No, I have emphasized it's a very serious condition and we must take care of it. If you are not on insulin, you don't need to worry about hypoglycemia. No, insulin definitely is a high risk for causing hypoglycemia because of the dosage, but oral medications also may lead to low sugar levels. Myth number 9, I can stop taking diabetes medicines once my blood sugar is under control. Unfortunately, that is not well supported by evidence. Yes, losing weight, eating a healthy diet, taking your medicines regularly, getting regular, consistent exercise, all these help and contribute in controlling the blood sugar levels. But diabetes, unfortunately, is a progressive disease over time. And we cannot immediately stop the medicines without consulting our endocrinologist or our specialist. It is very essential to keep going back to them every few months and check our HbA1c levels and sugar levels to stay fit and prevent any complications of diabetes. This brings me to the diabetes complications related to the diabetes. Diabetes is not a serious disease. No, it is. We have to be very particular about it. We have to be strict in controlling it because it could lead to many complications. Now, I'm so sorry. I'm not here to scare any one of you, but this is my area, emergency and serious conditions. So I would like to highlight few things. Diabetes can cause a heart attack. It can cause a stroke. It can cause damage to the eye, damage to the kidneys, damage to the nerves. You might, unfortunately, uncontrolled diabetic patients can have kidney diseases and burning sensation in the feet. All these are related to the complications of diabetes. So there are acute complications, which are small onset, like immediate onset, and then there are chronic complications. I will quickly run through the complications. Acute, like hypoglycemia, low blood sugar levels, diabetic ketoacidosis, and hyperglycemic hyperosmolar state. Last two of them are related to high sugar levels. High sugar levels and conditions that could cause dehydration and severe illnesses. I will talk about them in more detail later. Then there are some chronic diseases like retinopathy, which is complication in the eye, nephropathy, which is complication in the kidney, neuropathy, which is nerve damage, and some cardiovascular or peripheral artery diseases. Now, on and off, a diabetic may also have an uncontrolled diabetes, may also suffer from skin infections, dental problems, erectile dysfunctions, and so on and off chronic bacterial infections and fungal infections. So that was about the myths and the facts of diabetes. Now I will be talking about the diabetic emergencies. So hypoglycemia. You will see me re-emphasizing about hypoglycemia again and again because, like I said, it is a very serious complication. A patient with hypoglycemia will have symptoms. Usually the sugar levels will be less than 70. They might have shakiness, sweating, dizziness, giddiness, confusion, irritability, heart rate high, and more serious complications, they might even suffer a seizure. A seizure is basically an abnormal body movement which followed by loss of consciousness. And in those scenarios, if the brain is not getting enough sugars, we might have very serious complications. Now, usually the initial few symptoms are the ones that you might feel at home. And in that scenario, what can you do? What you can eat? So sugary juice, half cup, or hard candies, 3 to 4, half banana, 1 spoon sugar. Glucon-D, those are glucon powders that are there in water, 1 bread with jam. Immediately consumption of these things and rechecking the sugar level after 15 minutes can help you as a first aid. Now, some scenarios with hypoglycemia occur when the patient starts vomiting. They're not able to eat anything and they start becoming drowsy. That is the moment when you have to immediately take the action and bring the patient to the hospital so that we can give some dextrose through injection. Now, some tips that I found online that we can follow and can help us are: one, diabetic patients should always carry sugary snacks like a juice box, a small juice box, little 3, 4 candies, glucose tablets, or glucose powders kept in some pouch that can be used immediately, can be dissolved. They should preferably have a medical alert bracelet so others know that the patient has diabetes and can have a complication. They should tell their family, friends, co-workers, places at where they work that if such a scenario occurs, what should be done? If the patient becomes unconscious, what should be done? How the others can help them in this scenario. Now, diabetics should avoid skipping meals or taking too much insulin. Taking meals on short intervals every 2 to 3 hours, small portion, is set to maintain a good glucose level, maintain homeostasis, as Dr. Kennedy, Professor Kennedy said. We should also check the blood sugar levels before driving, exercising, going for a long drive, or preferably before sleeping. We should be extra alert when your doctors change your medications because sometimes they may over reduce the sugar levels and may cause long-term hypoglycemia. In an unconscious or drowsy patient, it is advised to report to emergency immediately without delay. Going on to hyperglycemia. Now, hyperglycemia is high sugar levels, and the symptoms would be is what you would feel is excessive thirst, frequent urination, especially at night, fatigue, sluggishness, blurred vision, irritability, mood changes, and increased hunger. So you will eat a lot, you will drink a lot, you will pee a lot, and you will feel tired and uneasy and irritable without any reason. Such scenarios, first thing that you do is drink water. Drink as much water as you can at home. Go for a small walk, light exercise can usually lower some amount of sugar levels. Water, approximately 1 liter water is advised to take as if you're able to, if there is no vomiting and you're able to take orally, it is advised to take at least 1 liter of water. Eat smart, avoid sugary foods, refined carbs, and choose fiber-rich meals. Medications, you need to strictly follow your insulin and medication plans as prescribed by your endocrinologist. And even after regularly taking your diabetic medicines, it is not under control, then you must consult your endocrinologist again. Seek medical help if symptoms worsen and report to ED, emergency. Now, DKA and HHS, diabetic ketoacidosis, hyperosmolar hyperglycemic state. These are the two extreme complications, extreme emergencies of hyperglycemia. Now, when does this occur? Usually it occurs when the sugar levels are above 300 approximately, and you might have symptoms like nausea, vomiting, fruity smell coming from your mouth, pain in your tummy, rapid breathing, confusion, drowsiness, dehydration, dry mouth, sticky mouth. You're not able to, talk properly because your tongue is so dry. Decreased oral intake. Now, this is the scenario when you should report immediately to the emergency. Your sugars will be checked. There is a set of investigations that we have in ER itself that tells us about the state of your body. It's called a venous blood gas. That test is done, and immediately IV fluids are started. Fluids, as in water, saline, is started, and insulin is given as required. So I think that's the end of my talk. And the most important thing that I would like to reemphasize is diabetes is a serious condition. We all are doing our part in controlling it and maintaining good levels. But yes, we have to be also aware about the complications that can occur and any emergencies that might need immediate help and shifting to the emergency. I think, thank you. I'll stop here, please.
Dr. Zara, Dr. Zara,
Yes, sir.
thank you, thank you. Now, friends, I am constantly amazed. This, we have probably had more than 50 or 60 of our webinars. 12 webinars a year, 5 years, that would make it almost 60 webinars. And yet, we learn new things every time. The series of myths that Dr. Zara spoke about were, well, I can't find words to explain that even after so many webinars, we learn new things. And in my area of specialty, exercise, we had 2 slides about the myths of exercise, and they were so relevant. Amazing. And the other aspect which Dr. Zara spoke about, which we frequently talk about, and that is if your blood sugar levels happen to be normal once more, can a diabetic stop medication? And Dr. Zara emphatically stated, check with your endocrinologist. Please do not imagine that just because your blood sugar levels are normal, you are not diabetic. It's a progressive ailment that can change with time and circumstances. New information. And thank you for that little bit about myths. And I can't tell you, Doc Zara, I must not admit things like this. But, you know, I have a blood sugar problem. It's probably not very serious, but nevertheless, I can relate to many of the things that you talk about, the fatigue and all those other things. Of course, fatigue could be relevant to my age and stuff. I'm only making excuses. Nevertheless, I must tell you there was absolute relevance in what you said to us today. Thank you, Dr. Zara. I will now leave you in the good hands of Dr. Wilcook, who will ask you several questions that I can assure you you will need all your medical acumen to answer those questions. Dr. Wilcook, sir.
Thank you, Professor Kennedy. First of all, thank you, Dr. Zara, for a wonderful presentation. As Professor said, every webinar we come across a new thing, a new statement, which enlightens us. Definitely, every time we are getting new informations. And as usual, you were just giving your presentation and start popping up some few questions also. Advik, I'll start with the first question. Advik Gurung. He has asked, I feel confused and disoriented many times. My both parents are diabetic. I check random blood sugar in regular intervals, which is mostly below 90. Is it diabetes? It's a very good question.
So I would not label you as diabetes at this level. Yes, there are tests that maybe you can go ahead and do. There is HbA1c, there is random sugars, fasting sugar levels, postprandial levels that can actually diagnose you as diabetes. Confusion, disorientation can be because of many reasons. It could be because of dehydration, it could be because of stress, it could be because of multiple other things. Maybe you're not able to focus about something. It would be better that if we talk more, then maybe I can understand the reason for the confusion and disorientation. But labeling you as diabetes, no. Unless you meet an endocrinologist, do proper investigations, it's not to get worried about it. And the confusion and disorientation that I talked about is usually in diabetic diagnosed patients. So I don't think, Advik, I think you should.
Yeah, he has mentioned about I don't have any other medical conditions. Maybe his parents are diabetic and he is little bit concerned about his controlling too much of his diet and doing more of exercise. Maybe whatever may be the reason. Okay, second question comes from Bhuma Kannan. People say diabetic patients should always keep chocolates with them for emergency. Is it true? You were talking about myth number 3. Even that correlates with that.
Yes. So myth number 3 and myth number, I think, 6 or 7. Chocolate or little candies, they should keep it in their bags or where they're going. Yes, but as an emergency, when you feel one of those symptoms of hypoglycemia, so sugar levels might go down, and or again, like I said, prolonged period of not eating, should be avoided in any patient. So suppose maybe you're out for work, you haven't eaten in 8 hours, then maybe this candy, this chocolate can help. So it's okay. You can keep a chocolate or candy, whichever is available. I personally suggest putting, those small Glucon-D powder thing that comes. There's a box for Glucon-D. It says Glucon-D, maybe different name here in UAE. That usually helps a lot in quickly recovering the sugar levels. Put it in water, 1 or 2 spoons, drink, and you're good to go, usually. So that
Yeah.
could be used.
There are many ORS also available which has high sugar levels on it just for emergency cases. Yeah, that's a good suggestion. Third question come from Aisha. Again, this is very interesting question according to your presentation also. It is said that low sugar is not dangerous. People are very much confused about these things and easily managed than the high sugar. What do you suggest? You have already mentioned both are bad, high and low.
Yes, I did mention. So, like I said, I spoke about two extreme levels of two extreme conditions where the sugar levels are very high. That is DKA and HHS. Now, this does not develop in all scenarios of high sugar levels. Now, a person might have 300 milligrams deciliters of sugar, but may not have one of these dangerous scenarios. But if a person has low sugar level, he definitely has a low sugar level. If not corrected on time, it will lead to low glucose levels reaching the brain, which is where we don't want it to go, which is where the complication actually occurs, and a patient might develop a seizure or epilepsy or unconsciousness. So I personally feel hypoglycemia is more scary than hyperglycemia, unless and until it has reached one of those two things that I talked about. And that can be diagnosed only in the hospital.
Yeah. Similar to your answer, there is another question from Mr. Singh. What emergency conditions can occur in diabetic patients?
So
This is actually very means needy questions because people understand if they are diabetic, they are on medication, they don't have to come into across for any emergency conditions. But there are many emergency conditions. So, what are the emergency conditions can a diabetic patient have?
Okay, like I said in my presentation, hypoglycemia, low sugar levels, hyperglycemia, very high sugar levels, any condition that is causing some some drowsiness can be an emergency related to sugar levels. Drowsiness, if I can explain more, is that you are sleepy and you are feeling tired and fatigued and you're not responding well to what the other person is saying. That is one of the most serious complications. Secondly, heart attacks. Now, heart attacks, I need to emphasize once more, in diabetic, long-term diabetic uncontrolled patients, they will not typically present in like a typical symptom. Now, a person with long-term diabetes, which is uncontrolled, will not have a proper chest pain like a normal other person. So in that scenario, even mild discomfort in the chest or in the upper part of the tummy might need some investigations for you, and it might indicate that you have a heart problem going on. So I feel these are the 2 or 3 things, plus kidney. If your kidney is affected in because of uncontrolled diabetes, it also comes as an emergency. You will have reduced urine output. Maybe you will have pain while passing urine. You will have frequent infections in the urine. So all of these can be considered as part of the emergency.
Yeah, I think the similar question is being asked by Mr. Mehra. What are the signs should be monitored for diabetic emergency? You've already answered, but I think you can elaborate a little more on this. What are the signs should be monitored?
So signs, what you will feel at home is shakiness, sweating, uneasiness, chest discomfort, tingling sensation in your fingers sometimes can be a reason, and excessive thirst. And sometimes patient might be drowsy or have some very high heart rate. That could also mean that something is going on with the sugar levels.
Yeah. Another question, very interesting. Just like your myth number 5, Angel has said, generally it is said to control diabetes, cut down your sugar. No sugar means no diabetes. Is it true? You have already mentioned about the insulin role on it.
Yeah, so it is not true. Sugar is not there only in the candies and the chocolates. It's there in a lot of substances, carbohydrates, fats also decompose and become sugar, glucose. Now, the thing, like I mentioned, it is about moderation. You can have a sweet or two on maybe the Shara or Eid or Diwali. It's okay. But moderation is the key. Cutting down sugar has a very significant role because it is easily converted to glucose and can get stored. But in general, cutting down on everything would, I think, make a better difference. It's not specifically sugar, it is maida, it is white bread, it is a lot of other things which has less fiber and more carbohydrate and fat content. Pizza.
True. True. Yeah. Pizza. Most favorite in this part of the world. Okay. Next question comes from Mr. Sarfraj. My brother has pre-diabetes, for which he is being advised for diet control and exercise. He has frequent urination during night and urine smells. Is it due to diabetes? It's a good question.
Yeah, it's definitely a good question. Now, your brother has pre-diabetes. If he is doing a good work with diet control and exercise, he should be able to have, he should be able to control his um, diabetes level in future much better. But frequent urination could mean that he's not, doing exactly the best control as of now. And a smell in urine and urination could mean only two things. Either one, the sugar control is not going very well and he needs more frequent monitoring, or number two, he needs to do a urine test to check for an infection. Maybe he's also having infection associated, which is kind of why he's having this smelly urine and frequent urination. So I would suggest that get a urine routine done for your brother and frequent monitoring of sugar levels.
True. Aisha has again asked one similar question. Is type 1 diabetes more dangerous than type 2?
So type 1 diabetes, type 2 diabetes, different entities, both are diabetic, but the only different in their profile is, I would not say one is more dangerous than the other. I would just say that the type 1 diabetes are usually seen in younger population. So the effect that they have on a patient starts off at a very early age. They have to take insulin by default. In that scenario, chances of hypoglycemia does increase if the doses are not correct, and chances of hyperglycemia also increases if the doses of insulin are not correct, and they are more frequently seen in the emergency. But I would not classify it as more dangerous or less dangerous. Maybe Dr. Wilco can have a opinion about it.
Yeah, that's true because type 1 is more mainly because insulin is not being produced properly, or the quality of the insulin is not good, or the insulin resistance is more. In that, you require insulin. And whereas type 2 is all lifestyle related, maybe whether it is a diet, maybe it is a sedentary lifestyle, maybe it is over stress, maybe you have bad health habits, tobacco, alcohol, and all other things, sort of things. So that could be managed easily with modifying your lifestyle. And if you have any other complications or anything, so doctors are there to support you. But type 1, if you are being diagnosed with type 1, you should be properly following the instructions by the doctors, whether you are on insulin, what dose you are been taking, regularly monitoring for insulin blood sugar levels before and after the meals. That is very important. So that's it. But I have another question just popped in my WhatsApp that I will ask. Yeah. Uh, One second. True. So the question is being asked by one of my patients who is attending this, but he's not putting the question in the chat box. He says, if I have diabetes and if I am not taking any medicine, I'm doing all my lifestyle modifications, like I'm doing regular exercise, 1 hour of walking daily, and I'm limiting my carbs in my diet. I'm morely on raw vegetables. Should I still worry about my diabetes or it's good? And I frequently am afraid of checking my sugar levels. That is also there. So,
So,
ma'am, your answer.
so see, ideally, you should check your, even if you're doing a good exercise, you're taking good food, frequent and consistency is there in your lifestyle. I'm sure you're having a better control of your diabetes than the others. But being aware, I feel, is more important than being sorry. So maybe once in a while you can check your sugar levels, or every 3 months you can check your HbA1c levels and see how things are progressing for you. So I feel HbA1c is a very good investigation that we can use to see the last 3 months. How have we been doing the last 3 months? So every 3 months, every 6 months, if you do HbA1c, if not frequently, that can help you understand how your progress is. And regarding
And
the
what
medicine,
result your effort is giving. That's
yes,
true.
yes. So that I think can be done. But again, stopping the medicines if your doctor has prescribed is not advised. I would suggest stay in constant touch with your endocrinologist. And if you're doing a fine job, I'm sure you're doing a good control of your sugar levels. But if any of those emergency situation occurs, those symptoms that I talked about, please don't think twice. Come to
Yeah.
them.
Let the doctor decide to regulate the dose if everything is well controlled. Let the doctor decide. I think questions are over, but I will ask one question as a takeaway message from an expert in emergency medicine, not only for the diabetic patients, as a whole. What signs and symptoms a person should be monitoring for approaching an emergency department? What are the things should be monitored? Any signs, symptoms which you consider these, okay, top, these are the 5 top signs and symptoms where you should immediately report to the emergency department.
Yeah, so there are a few of the emergencies that cannot be ignored and need more awareness about. Like one of the things that I really feel is symptoms like dizziness, one. Second, weakness or tingling sensation of any part of the limbs, upper limbs or the lower limbs, and slurring of speech, like you're talking but you're not talking normally, somebody points out no, something is wrong. All of these symptoms could indicate minor strokes. So in those scenarios it is very essential to come to the emergency as soon as possible. We have a golden period of around 4 hours, 4.5 hours, where if you come to us and god forbid you have a stroke, blurring of vision or double vision, now if you have stroke, we have a medicines that can completely revert and solve things for you. So I like to emphasize on this one. Second, on chest pains. Now, not only chest pain, pain in your jaws, pain in your shoulders, pain in your arms, not just the left arm, right arm, left arm, any pain related to chest or the jaws or the neck or the back can be a heart related problem, especially in older population, especially in people who have long term diabetes or heart disease or have a high risk of smoking. So these two I feel are very important. Apart from that, maybe breathing difficulty. Now weather is changing and everybody's getting flu and everything, but if you develop symptoms like you're having some wheezing sound, zzz, like a musical wheezing sound is coming while you breathe, and you're not able to complete your full sentence, that's where I feel you should immediately come to the emergency. I think that's enough scaring everybody, doc.
Yeah, true. And I would add to it because we have been visiting the corporates and we find many people, those who know themselves that they have high blood pressure, or many people, those who are on medication for blood pressure, but still their blood pressure is too high. When I'm there, so I just immediately refer those patients to emergency department to take care of it, because blood pressure is more than 210, 200 by 160, 150 like this. And patient, the individual doesn't feel any sign and symptom. They so everything is fine. I'm on my work. They don't think that is this condition is very emergency. And I would rather suggest and request everyone, those who feel like this, they should be monitoring their blood pressure frequently. And if it is over the high side, always consult a doctor. Even if you have consulted recently, but if you find, go to the doctor again and tell the complaints that these are the readings. Let the doctor decide for it. I think that's over from my side. Thank you very much, Dr. Zara. Professor, over to you.
I was just checking I was just checking my mobile to see if I had Dr. Zara's number. After listening to the question posed by Dr. Wilku, what are the signs and symptoms that we should keep in mind? And Dr. Zara spoke about dizziness and slurred speech and pain, and then she correlated it with stroke, cardiac, breathing, etc. I immediately reached for my phone and thought, gosh, I must keep Dr. Zara's number on my phone. And since I don't have it, I'm going to give Dr. Zara a call soon after this through the reception and request her number. With your permission, Dr. Zara, I will have your number on my phone so that I can connect with you whenever I need to. And with that, thank you
Right.
so much, Dr. Zara. Thank you so much.
Thank
Thank
you
you.
so much, sir. Thank you, Dr. Wilku.
Okay. And to our audience, I don't know whether I should thank you or whether we should thank Dr. Zara, because it was such a informative, simple and informative session. But from my side to my dear audience, thank you. And my colleagues in Arabian Wellness and our IT colleagues from RAC Hospital, thank you for your constant work. I notice that we have the next webinar on our screen, and it's strong body, steady sugar. And we have a new specialty in this one, and that is physiatry. That's a new specialty. I have to congratulate Dr. Wilku. Even after 50 or 60 webinars in this, in diabetes, and probably 50 or 60 or more in weight loss, we still have new information almost in every webinar. Thank you so much, Dr. Wilku. Thank you so much. And I'm looking forward to meeting with all of you on the 10th of October for our next webinar. Thank you and have a great day.